Okay, we're going to talk about how to do your patient lists in Greenway. So this should probably be your main screen. If you remember when we did customized desktop, this is essentially what you should be seeing. So this area over here, bordered by my mouse, is the patient list. And this is kind of tells you where patients are and who you're going to be seeing for the day or who other people are seeing for the day. And this is very customizable, and you're going to play with it until you find what you want. So first of all, I'm going to show you, this is how you open filter administration, is how you're going to be changing the filters for your patient lists. This little thing is a resize window. You'll probably never play with that, but you'll want to make it as large as possible, and that's really the only thing you can do. Refresh patient list is self-explanatory. Photos, don't do that. It'll show you pictures of patients. There's no reason to ever do this. Auto refresh, you will probably always want checked. Okay. What this does is every 20 seconds it will refresh the patient list to see if anyone is checked in or if your schedule has been changed. This over here is your calendar. You can change the dates that we're looking at. You can go down, you can go up, and you can see different whichever patients are there for the day. And anywhere in Greenway where you see this big calendar, you can click there and you can choose any date that you want. Okay, and again, if we leave it auto refreshed, in about 20 to 30 seconds, it will refresh back and show you the list for the day. Okay, other things to see, the filters, you can see the different filters. I have Laerfeld, that's me, but if you click over here, you'll see all the different various filters. We'll go through some of the ones that you should probably have. You should probably have testing filters, and you should probably have a hospital rounds filter. This lightning basically runs the filter for the day. When you click there, it will run whatever filter is in your queue over here. Use. Click over here, filter administration. These things. You may want to pause this video for 1 second just so you can see the different boxes that I clicked over here. Okay, and then you may want to copy these over. This is how I set up my filters, and for the most part, it's probably the easiest way to do your filters, but everyone has a different approach to what they like to see and in what order. The first thing you're going to want to do is you're going to want to create a new template. So what you will do is, for example, you may want to type your name. You'll click over here, type your name, and then when you're ready, you click this over here, save as a new rule filter. I'm not going to do that right now, but that's how you will do it. You will save, no, actually I'll do Laerfeld-1, and I'm going to click over here, save successful. So now I have a new filter, and if you click over here, you'll see I have a Laerfeld and a Laerfeld-1. It copies over everything exactly so I can change it as I want. And again, same things over here, refresh filter from save. This will actually run the filter and go back to the main screen. This will save it without making a new name, so when I make changes to my filter, I can just click that, and then later on I'll click delete just to delete this. So we'll come back to 1 in a moment. That's really the bulk of this. 2, display in patients list. So I like to see my no-shows as well as checked in, checked out, and unchanged. If you also want to see patients who have canceled and rescheduled, you can click those as well. But this is how I like to see. I like to see my patients who are about to come in, my patients who are checked in, and as well as patients who didn't show up. If they canceled or rescheduled, I don't want them on my list. It takes up too much room. Visits without appointment. You don't really. You will see patients who have an appointment. So I just leave this check. You don't really have to worry about it. If I have block time, if for example I have a meeting or I need to leave early for some reason, I like to see that on my list also. Visits from a previous day, there is no reason to check that. Navigation. On the clinical side, seeing patients, I find it easiest that when I click on a patient, it will go directly to the patient's chart. So this is and single select. So this is what I choose. Some doctors, however, like to have the ability to double click. Or not to go in directly. So they will actually click on Go to Patient's Chart. And what that will do is they will have to highlight the patient and then click on the chart icon to go into the patient's chart. I'm not exactly sure why they like it that way, but they do. So that is an option. And I would not choose any of these other options. Go to Visit Information, go to Charges. That's more for billing. Okay, so these are the categories that I like to see on the one for my filter. Okay, and again, you may want to copy these directly. You can look at some of these other things. You won't some of these like date of birth. You don't need to see that on your first screen. Okay, so I like appointment type, patient name, patient ID, status. And this will, when you click over here on these little icons over here, it opens up, it explodes, and lets you choose other things, just so you can see. All right, area. Okay, these are the different areas of the pods, so it will actually show you these are different selections that will show up in the area. The area is basically so status will show you that the patient is checked in generally. So you'll probably want that. Area is very important. You'll definitely want this because it will show you where the patient is. If you're going to see the patient in room B2, the check-in attendant will put in B2, and that will show up. Really what we use. We don't really use chief complaint, believe it or not. So I'll just get rid of that for the time being. If you uncheck it, it goes away, and it'll go down over here. If I want to move it back, I could check it back in. The order that these are listed in are the orders that it will show up in your list. Okay, so if I want this back in, I can actually move this off the list. Just for this demonstration, I'll move it to the top. Okay. And I want to see all these different various appointment types. Okay, you may want to copy these over. Okay, these are different types of appointments, and you highlight whichever ones you want, and you click OK. Resource is you. Okay, not doctor, not care provider, not doctor. You are the resource. Okay, so this field you absolutely must have in your filter, otherwise you won't show up. So what you'll do is you'll click over here, and you will highlight the resource that you want, which is you, and then you will click OK. If you don't do that, your list will not be correct. Okay, and then other things like that. I like visit type, time in, time out. It gives me an idea on following my times. Appointment location. So you will want to highlight our offices if you're making a filter for seeing patients in the office. So you'll want, basically right now, Cape May, Galloway, Manahawkin, Sewell, Summers Point, and Voorhees. Just to go over some of those other locations, Z is a facility that we don't see, that we do procedures at or go to hospitals. So right now, if it's X city or X mainland, that's an outpatient at city or mainland. If the patient is an acuity patient, they are at the acuity. The ASC, anything with an ASC is a surgery center. So you'll also want to highlight these because your patients for the surgery centers will be checked into there as well. So you'll want Z ASC Ocean County, Z EHT Surge, Z Mask is the Stone Center, which I go to occasionally, and you'll probably also want this Z WTASC, which is another surgery center. Z Access and Z JSAC are other surgery centers. I just don't go to them. And then you can click OK. All right. So that's resource, and like I said, I like these other parameters as well. Super bill. You know what? I probably don't really need this, and I'm going to get rid of that. All right. So again, we will click Save, and then we're going to click this to run our new filter. So as you can see, it ran the filter with exactly what I told it to do. I told it to put chief complaint first. So obviously this doesn't make any sense. So I'm not crazy about that filter, but that's what it will do. You can design the filter to do whatever you like. All right. So and if you click over here, I'm going to choose the other filter that I like. Now, another thing that you'll want to know about hospital patients. Hospital patients, we all make appointments for ourselves. All right, so I usually use a rounds. Mine is called hospital rounds template. Okay, and this shows all the patients who are to be seen today in the hospital. Notice that they're yellow. That means that they've been checked in. I'm going to show you how to do that in a moment. All right, so for this filter, you're going to want to copy over these exact parameters. All right, patient name, appointment location. Now, in this case, we're going to have Acuity, Bacharach, City, Mainland, and actually also Virtual Marlton and Virtual Voorhees. So I'm going to add those, and then I'll save them later. Comments, if the doctor puts in comments for what's wrong with the patient or what needs to be done, that will go there. Appointment type, we're going to put in procedure and rounds. Now, really OR and rounds. So rounds is the appointments type that we make for patients who are going to be seen in the hospital. And we'll click there. And then appointment date, you can leave it that's what we have. That's the date today. And that's how it shows up. So again, you see patient name, location, mainland or city. Comments, no comments were put in today. Appointments, these are for rounds. Resource, since we did not designate a resource, these are all going to go in. It's going to show every resources, and Charles is rounding today. So real quick, just so you know, I resized this, and I can resize this anyhow that I like. I'm going to take off this auto refresh, or it's going to keep refreshing. It's going to keep resetting. I'm going to change this. All right. So every time I change a column or a row or a column, it's going to reset very quickly unless I save it with the parameters. So I'm going to double click here, and then I'm going to do save column widths, and then it's going to save that from now on. Again, this chief complaint I can probably get rid of. I just never did. All right, so I get rid of it. I'm going to check it, save, hospital rounds, and now that chief complaint is gone. And this is how my hospital lists looked. Okay, so those are the parameters you're going to want for that. The other thing is we do testing appointments. If you are signing testing appointments for the day, you're going to want to set up testing Galloway, Manahawkin, and Summers Point, as well as what other offices we have at the time that you're seeing this. Okay, and just so you can see, we don't have it's Sunday, so the office is closed. But this is how you would set up your testing appointments. Again, you probably want these parameters. Okay. Status really isn't that important. You may not even need that on your area. You may not even need that on your filter. However, appointment type, the most important thing here is testing appointments. You can really highlight all of them. Resource, this is really all you really need for this filter is resource. And since this is testing Galloway, you're going to want resource testing Galloway. Okay, and then again, you're going to, every time you do this, you want to hit save and plus. If you just hit save, it's going to copy over the last template that you had. Okay, so that obviously you don't want that. So every time you hit the save box with the plus, it will add a new filter for you. Okay, so if I, like I showed you before, if I hit Galloway, or testing, and I hit this, it will make a new filter, and then I could just change the one parameter. I can go from testing Galloway to testing Summers Point to testing whatever, and every time I just hit this plus over here, it will create the new testing. It will create the new template for me. So you're going to want a whole bunch of templates. You're going to want your name as a template. Okay. And let me just go back here for a moment. I'm going to show you how to delete a template. I'm going to get rid of this one. Do I want to delete this filter? Yes. All right. All right. So this is so this is and choose sort. You'll probably want to do this appointment date, appointment time. That's how it sorts your appointments on this. So this is my main template again, and you're going to want to hit there, save and plus, and it's going to create your new templates for you. Every time that you do that, you can just change whatever parameter you want. So you'll want to make the testing ones, you'll want to make the rounds ones. You can use the same fields for all of them. Just make sure that you change the resource or you change the location as we went over. Okay. So that's basically how you, and again, you want to change all these parameters like we discussed. So that's basically how you do your filters. All right. And you'll probably want this auto refresh thing checked. Now, check-ins will generally occur in the office by the kiosk. Okay, when the patient is checked in, they will be highlighted yellow, and when you click when this is highlighted yellow, you will click there, and since I have it set up to go directly into the chart, this is what it does, and this is the patient's chart with the face sheet that we set up earlier. Okay, I'm going to go back now. In some cases, you'll need to check the patient in yourself. All right. What would those cases be? Well, if you're operating, if you're doing surgery at the surgery center, usually our employees will check your patients in, but if you have an add-on case, you'll have to add that in. You'll schedule it for yourself as per the scheduling videos, and then you'll need to actually check the patients in. And in the hospital, the same thing, especially on weekends, you'll need to check patients in yourself. So how do you do this? I'm just going to show you real fast. You go to registration, you go to visit information, check-in. Okay, and your filter, your patient list template will be running at the top. You will highlight the patient, and then their information will be pulled into the visit details queue. You will then click check-in. And now they turned yellow. Once they are checked in, you can go into the chart and you can create a note, and you can build charges which will be associated with your account and get sent to billing. If they're not checked in, this will not occur. So do not do notes or anything else like that on a patient unless they are yellowed out like that. Unless they are yellowed like that. And that is in a nutshell the patient lists in Greenway.